Welcome to today's video, where we'll be discussing a rare yet significant condition known as nephroblastomatosis. This condition, closely linked to Wilms tumor, affects the kidneys, primarily in young children. We'll delve into its causes, how it impacts the body, and what can be done to manage it. The exact cause of nephroblastomatosis isn't fully understood, but it's believed to be linked to genetic mutations and developmental abnormalities during kidney formation in the womb. Certain genetic syndromes, such as Beckwith-Wiedemann syndrome and Weill syndrome, are known to increase the risk of developing this condition. These syndromes are associated with mutations in genes that regulate growth and development, potentially leading to abnormal kidney cell growth. Nephroblastomatosis represents the presence of persistent nephrogenic rests, which are remnants of immature kidney cells that should normally disappear after birth. Instead of differentiating into mature kidney tissue, these rests remain and can potentially develop into Wilms tumor, a type of kidney cancer. The size, location, and number of these rests influence the risk of tumor development. The presence of these rests disrupts the normal architecture of the kidney, potentially affecting its function. However, in many cases, nephroblastomatosis is asymptomatic and only discovered during imaging for other reasons. Nephroblastomatosis is rare, especially when considered outside the context of known genetic syndromes. It's more commonly found in children with certain predisposing conditions. The incidence is difficult to determine precisely because it often goes undiagnosed, especially in mild cases. However, it's estimated that a significant percentage of children with Wilms tumor also have evidence of nephrogenic rests. Screening programs in children with genetic syndromes known to increase the risk of Wilms tumor have helped to detect nephroblastomatosis more frequently. Often, nephroblastomatosis doesn't cause any noticeable symptoms, especially when the areas of nephrogenic rests are small. It's frequently discovered incidentally during imaging studies performed for unrelated reasons. However, if the nephrogenic rests are large or numerous, they may cause an enlarged kidney or abdominal mass, which can be felt during a physical exam. More rarely, related symptoms could include abdominal pain, high blood pressure, or blood in the urine, although these symptoms are more commonly associated with Wilms tumor itself rather than nephroblastomatosis. Diagnosis typically involves imaging techniques such as ultrasound CT scans or MRI of the abdomen. These scans can reveal the presence of nephrogenic rests within the kidney. Biopsy may be performed to confirm the diagnosis and rule out other conditions, including Wilms tumor. Genetic testing may also be conducted to identify any underlying genetic syndromes that could be contributing to the condition. Regular monitoring and surveillance with imaging are crucial in children diagnosed with nephroblastomatosis, especially those at high risk of developing Wilms tumor. While not strictly classified into distinct types, nephroblastomatosis is often described based on the location and characteristics of the nephrogenic rests. Diffuse nephroblastomatosis involves widespread involvement of the kidney, while multifocal nephroblastomatosis involves multiple distinct areas of nephrogenic rests. Perilobar nephrogenic rests are located in the outer portion of the kidney, while intralobar nephrogenic rests are found in the inner part. The specific characteristics influence the management approach. Treatment and management depend on the size and location of the nephrogenic rests, the child's age, and the presence of any underlying genetic conditions. In some cases, close observation with regular imaging may be sufficient, especially if the rests are small and stable. Chemoprevention, using medications like vincristine, may be considered in high-risk cases to prevent the development of Wilms tumor. Surgery such as partial or complete nephrectomy or kidney removal may be necessary if Wilms tumor develops or if the nephrogenic rests are large and causing symptoms. Treatment protocols are tailored to each individual case. Currently, there is no known way to completely prevent nephroblastomatosis, as it is often associated with genetic factors. However, early detection and close monitoring in children with genetic syndromes that increase the risk of Wilms tumor are essential. Screening programs with regular abdominal ultrasounds can help identify nephrogenic rests early on, allowing for prompt intervention and potentially preventing the development of Wilms tumor. Genetic counseling may be beneficial for families with a history of Wilms tumor or related genetic conditions. The prognosis for children with nephroblastomatosis is generally good, especially when detected early and managed appropriately. Many children with nephrogenic rests do not develop Wilms tumor. However, the risk of developing Wilms tumor is higher in children with nephroblastomatosis compared to the general population. Recent research is focused on identifying biomarkers that can predict which children with nephrogenic rests are most likely to develop Wilms tumor. This would allow for more targeted interventions and potentially reduce the need for aggressive treatment in low-risk cases. Studies are also exploring new chemoprevention strategies and targeted therapies for Wilms tumor.